Senator Smith.
Thank you, Chair Sanders and Ranking Member Cassidy. And thank you so much, Dr. Bertagnolli, for being here. It's wonderful to see you again, and I'm just delighted to have the opportunity to support your nomination on this committee, and also as we move you forward to confirmation. I'd like to actually follow up on something that Senator Barrasso started with and focused on, which is your personal experience in Wyoming, experience in rural America. I'm not going to ask you about the ranch, although I'd be tempted to. But I think it meshes with a very clear policy interest of mine, which is around rural health and a focus on rural health. And we know that in healthcare settings across the country, there's a real shortage of healthcare workers, and that this effect is really felt particularly intensely in rural communities that are struggling to maintain hospitals and maintain access to care. Now, we've had some important innovations over the last several years. I would point specifically to telehealth as a way of delivering care. But could you please just talk with us a bit about, as you think about your own personal experience in rural communities, how can the NIH ensure access to the most advanced medical research and other treatments, regardless of, and especially if you live in small towns and rural places in this country?
Well, thank you so much for that question. You know, our job is not done if we just produce an effective treatment or an effective approach. Job is not nearly done. Our job is only done when people are living long and healthy lives, free from and so that means that a critical area of NIH research needs to be health care delivery research. And I'll just give you a quick personal note. Town where my parents lived in central Wyoming, no hospital within 100 miles. Through state, community, federal, and tribal participation, there's a new hospital being built there. And I am committed to seeing that new center in that new location be brought into the research enterprise so that we can understand how these kinds of federal, state, tribal, community partnerships can be brought to bear to be able to deliver better care. Just one example.
Well, that's great, and I appreciate what you're highlighting, which is the importance of partnerships, but also the real importance of NIH attention to training and research opportunities in rural communities, because I think there's a lot of good data to show that if you are trained in a rural place, then you're much more likely to stay in that rural place, and there are good examples, good best practices for how to do that. And I have to say I share Chair Sanders' concerns about our challenges delivering care in this country. And so I think there's lots for us to work on there. Another area that I want to just touch on before I wrap up is the importance of focusing on research around mental health care. This is something that, again, is a very, very important issue to me. Less than 5% of the NIH's health budget goes to the National Institute of Mental Health. So less than 5% of the overall budget, while 1 in 5, or about 20% of Americans, are going to experience some sort of mental health issue every year. So, and we know that mental health and physical health are not like two completely separate things. It's brain health and the rest of your body health. So could you talk a bit about how you view the NIH's role in focusing on that connection between mental and physical health, brain health, and the rest of your body health? And given this low percentage of funding, how can the NIH advance research on mental health?
Oh, thank you. I think, first of all, mental health affects every single disease we treat.
Yes.
You know, it affects how someone can manage their cancer journey. It affects how somebody who's got kidney failure is able to get the needed care. It affects every single thing we do. So one of the things that I'm really excited about, if confirmed, on taking on the role, is to really focus on all of these interactions between the various institutes where there are common themes that need to be addressed even in order to treat these individual diseases. Mental health is overarching and really needs to get into every research institute. That's number one. And then number two, that will also help us best leverage the funding that goes into the Mental Health Institute, being able to pull on that through resources throughout the entire NIH. And thank you for your advocacy and raising this really important issue, raising awareness.
Thank you. Thank you very much, Mr. Chair.
Thank you.